Hello everyone and welcome back to our channel. Hope you all are enjoying learning with easy dentistry. All lectures on our channel are absolutely free of cost. So you have to do just one thing, that is subscribe to our channel and hit on the bell icon so that whenever we upload a new lecture, you get a notification of it. So today we have uploaded this part, that is the part 2 of the basic concepts of the antimicrobial therapy. I recommend you all to watch part 1 first because it is extremely important topic for exam point of view. The link of part 1 is provided in the description box. So let's begin with today's lecture, in which we will discuss how to choose a antimicrobial agent or the factors influencing the choice of an antimicrobial agent. Now, there are three types of factors which influence the choice of an antimicrobial agent. These include the patient factors, infecting microorganisms associated factors, and the drug factors. Now, let us study each of them in detail. First, the patient factors. The patient factors include the age of patient, the renal and hepatic function in the patient, the local factors associated, the drug allergy, impaired host defense, pregnancy, and genetic factors. Now, elderly patients show increased T-half of aminoglycosides, and because of this increased T-half, there is 8 now toxicity. In patients less than 6 years of age, tetracycline should be avoided because tetracycline gets deposited in the developing bone and teeth and causes weakening and discoloration of them. Now, second factor associated with the patient is the renal and hepatic function of the patient. If there is organ dysfunction in the patient, the dose of the drug should be adjusted. Now, if a patient has renal failure which is of mild category, then the doses of these drugs should be reduced, like aminoglycosides, amphotericin B, cephalosporin, ethambutol, vancomycin, and flucytosine. Moderate to severe renal failure requires reduction in the dose of metronidazole, cotrimoxazole, carbapenicillin, fluoroquinolones, clarithromycin. And drugs which are totally avoided in renal failure include nalidixic acid, tetracyclines, and nitrofurantoin. Now, patients with renal diseases, the dose of the drugs should be reduced, and these drugs include chloramphenicol, isoniazid, rifampin, metronidazole, and clindamycin. And the drugs avoided during the liver failure is erythromycin, tetracycline, nalidixic acid, and pyrazinamide. Now, the local factors associated with the choice of the antimicrobial agent include the pus discharge, necrotic material or any foreign body, hematoma, reduced pH, abscess, and any penetration barriers if present. Now, presence of pus reduces the activity of an antimicrobial agent. So, the pus drainage should be done. Pus drainage causes a reduction in the number of causative organisms. It also kills the anaerobic microorganisms because by pus drainage, these anaerobic organisms come in contact with oxygen, which kills them. Also, pus drainage increases the diffusion of antimicrobial agent in the pathological lesion. Now, if there is presence of any necrotic material or foreign body, the bacteria tends to adhere to this foreign body, forming a biofilm, and this biofilm is very difficult for the antimicrobial agent to penetrate. Now, hematoma is associated with increased bacterial growth. Tetracycline, penicillin, and cephalosporin tend to bound with the degraded hemoglobin present in the hematoma. If the local pH is reduced, there is decreased activity of macrolide and aminoglycosides. If there is abscess formation, at the center of the abscess, there is anaerobic environment. So, there is reduction in the transport of the antimicrobial agent to the center of the abscess. Then if any penetration barriers are present, this reduces the access of the antimicrobial agent. Example of such penetration barriers are subacute bacterial endocarditis and the root canals of the teeth. Now, the fourth factor associated with the patient are the drug allergy. If the patient is allergic to any drug, the history should be obtained and those drugs should be avoided. Alternative drugs are used in such cases. If the patient is allergic to penicillin, then you can go for erythromycin or clindamycin. Then beta-lactams, sulfonamides and fluoroquinolones are the frequently allergy-causing drugs. Now, the impaired host response also affects the choice of the antimicrobial agent. If the host response is normal, then a bacteriostatic antimicrobial agent is used, but if it is impaired, then a bactericidal drug is used. Now, in pregnancy, there is a risk to fetus. So, tetracycline is totally avoided in pregnancy because it causes liver atrophy in mother, pancreatitis and kidney damage in mother. In fetus, it causes tooth discoloration and bone deformity. Also, aminoglycoside causes fetal ear damage, so it should be avoided during pregnancy. Metronidazole is considered to be non-teratogenic and penicillins, cephalosporin and erythromycin are considered to be safe drugs in pregnancy. Now, the second are the organisms related factors. Clinical diagnosis is very important before deciding which antimicrobial agent should be used. For any orodental infection, first the identification of microorganism and the antimicrobial sensitivity should be determined, but this is a slow process. Mostly alveolar abscesses, periodontal abscesses, pulp infection, chronic periodontitis and ANAC is caused by bacteroids, Fusobacterium, Porphyromonas, Prevotella, Vilonella, which are mostly gram-negative. Few gram-positive organisms are also involved like Streptococcus viridans and spirochetes. Abscesses are mostly formed by anaerobes, so orodental infections are considered to be mixed infections. The drug of choice is maybe penicillin or amoxicillin with or without clavulanic acid. Certain cephalosporins such as ceforoxim and cefaclor can also be used. Empirical therapy, which is used by most of the dentists, is amoxicillin and metronidazole combination. For ANAC, penicillin or doxycycline plus metronidazole is used, and for the treatment of thrush, nystatin or clotrimazole is used. Now, third are the drug-related factors. The first drug-related factor which is helpful in choice of an antimicrobial agent is the spectrum of activity. Narrow-spectrum antibiotics are used for definitive therapy, while broad-spectrum antibiotics are used for empirical therapy. Secondly, the type of activity. Bactericidal drugs are more preferred than bacteriostatic drugs. These are more important in acute infections. Then the relative toxicity of the drug. Obviously, the drugs with least toxic effects are preferred. Then the pharmacokinetics of the drugs such as absorption, distribution, the T half of the drug and the process of excretion are also important in determining the choice of the drug. Then the route of administration may be oral or parenteral. Aminoglycosides, penicillin, cephalosporins and vancomycin are used as injections only. Then the clinical efficacy of the drug can be determined by the various clinical trials, and this is one of the important factor in the choice of antimicrobial agent. And the last factor is the cost. Obviously, the drug with least cost is preferred. So here we complete with the factors associated with the choice of an antimicrobial agent. The next lecture will be on sulfonamides. Please subscribe to our channel if you have not yet done, and also put on the notification bell. That's all for now. Happy studying.